The flu outbreak across the country has reached an epidemic level in the U.S. That's according to the CDC. 47 states are reporting elevated levels in flu activity this week. Here's a map from the CDC. Michigan last week was in the dark red, which represents the highest activity level of the flu. Now, we're still in the high level this week, but you can see that we're in the orange. That's because cases overall have dropped here. But when you break it down by regions, the number of cases in mid-Michigan is actually on the rise. Ingham, Eaton, Clinton, Jackson, in Hillsdale, that's the southwest region, saw a 7% jump in the number of doctor visits for the flu since last week. 115 people in Michigan have been hospitalized with influenza. 4 kids and 2 adults have died. It can be almost impossible to not spread the virus when you're sharing a space with almost 50,000 other people. Students at Michigan State face that problem every day, and it's even easier to get sick during flu season. Anthony Sabella spoke with MSU students and staff about their flu concerns.
Michigan State freshman Adrian Spring may not have the flu now, but last semester she was no stranger to being sick.
It was bad. I had to go to the health clinic like 4 times. I'm sure I'll get sick again.
Junior Audrey Wright says she's also not sick now, but she knows plenty of others who are.
I know a lot of people are just skipping class this first week too because they're not feeling well.
As Olin Health Center continues to see the yearly influx of students with flu-like symptoms, the #1 question for students is,
how do I not get sick?
How to prevent it?
Dennis Martell, the Health Education Services Coordinator for MSU, says a lot of it has to do with the hands.
More than anything, keep your hands clean, because in the residence hall it's very easy to pass colds and flus and stuff like that when you don't keep your hands clean.
According to the Michigan Department of Community Health, the best way to avoid the flu is getting a flu shot. But if students don't have access to the vaccine, there are other things they can do.
Disinfecting common surfaces, tables, countertops, door handles, things that people commonly touch.
Anthony Sabella, Fox 47 News.
The best option for students if they do get sick is to rest for 3 days when they will be most contagious.